Ministry of Health has sounded an alarm over the escalating instances of respiratory and vector-borne diseases attributable to the adverse effects of climate change. Health Principal Secretary Mary Muthoni has projected an increase in respiratory diseases attributed to the cold conditions induced by heavy rains. This as many counties continue to grapple with the adverse floods that continue to wreak havoc, claiming the lives of 168 people. Elizabeth Atieno with more.
Tonight, the Ministry of Health has raised concerns on thousands of Kenyans whose lives are at risk following a possible cholera outbreak in many parts of the country due to floods.
The emergence and re-emergence of some diseases like cholera, polio, we must sort out climate change.
Over 500,000 people have been displaced, facing exposure to cold weather that increases the risk of respiratory diseases such as flu, cough, and pneumonia.
Climate change contributes to a larger percentage of our respiratory diseases. It's a high time we took it seriously. His Excellency the President has already given us a challenge: 15 billion trees by the year 2032.
The heavy rains paints a grim picture of the adverse impacts of climate change. Public Health Principal Secretary Mary Muthoni has raised concerns on the projected rise in respiratory and vector-borne diseases if Kenyans fail to join hands and implement climate mitigation measures.
No, you and myself, we know that if we do not plant trees and we allow our soil to get eroded, and at the final end, we may not have the crops, the products from our farms that we anticipate, then we are bound to get malnutrition. We are bound to get displaced. We are bound to have children who may not be going to school.
Muthoni's statement follows a prior warning from the office of the government spokesperson about storms and intense rainfall expected in Lake Victoria, Western Kenya, and the South Rift Valley.
The ministry will continue to collaborate in sourcing for resources to support various emergency response efforts in this country.
The Ministry of Health is working tirelessly to issue emergency responses to locals at risk of contracting malaria. Elizabeth Atieno, TV 47.